ALS begins affecting the control of the hands, feet, and limbs, progressively spreads to the rest of the body. As the disease develops, more nerve cells are destroyed and the muscles continue to get weaker. The signs someone with ALS might recognize begin with twitching, weakness, and slurred speech. Eventually, they will lose control of the muscles needed to move, speak, eat, and breathe. Someone that has obtained ALS may suffer from these symptoms: difficulty walking, lack of balance, weakness in the legs, hands, feet, and ankles, slurred speech, difficulty swallowing, muscle cramps, twitching, and difficulty keeping good posture, holding your head up. Final causes and risks of ALS. The cause of contracting ALS is still not yet completely understood. The only certain cause we know of at this time is that ALS is inherited 5 to 10% of the time. ALS is not contagious, therefore you cannot get the disease from someone. That is it unless you guys are related. However, researchers are looking into these possible causes: gene mutation, chemical imbalance, diagnosed immune response, protein mishandling. There are some possible risk factors established that may contribute to contracting ALS. These risks include age. People between 40 and 60 years old are found to be more susceptible. Sex. Before the age of 70, more women are likely to develop ALS. Genetics. It has been found that people with ALS share similar genes. Finally, heredity. In most cases of familial ALS, the children have a 50-50 chance of developing it. Environmental risks may include smoking, toxin exposure, and military service.
ALS is a difficult disease to diagnose because the initial symptoms are very similar to other diseases. A neurologist will generally use a process of elimination to diagnose ALS. Some other diseases that are like ALS are amyotrophic lateral sclerosis, progressive muscular atrophy, progressive bulbar palsy, and post-polio syndrome. Now, some of the initial tests that doctor will run would be a blood and urine test, a electrodiagnostic test including electromyography, EMG for short, and nerve conduction velocity. Now, the most important of these is the electromyography, the EMG. This is the most important because it tells you where you have any sort of nerve damage. Now, that can be also related to muscular damage, but with the other tests previously mentioned, it will show the neurologist that you have ALS.
Go.
ALS is a disease that is not curable. Drugs like riluzole help treat ALS. Although riluzole is expensive and not fully effective, it does help slow down the disease. In general, treatment helps control the symptoms of Lou Gehrig's disease. Medications such as baclofen or diazepam may help control spasticity. Gabapentin may be prescribed to help control pain. Other drugs can help patients swallow saliva. Choking is also common as ALS progresses, so many patients may need a tube called a PEG tube or feeding tube to be placed to the stomach to help feeding. An appointment to an otolaryngologist, an ear, nose, and throat specialist may be recommended. Physical therapy, rehabilitation, braces, or a wheelchair and other treatments may help muscles work as well and improve someone's general health. Those that have difficulty speaking could get better from speech therapy and/or speech synthesizers and computer-based communication systems. ALS patients eventually cannot function and care for themselves. They may survive from 2 to 10 years after diagnosed with the disease. About 20% of ALS patients live more than 5 years after the diagnosis. Since 2014, approximately $20 million has been invested in Canadian ALS research because of money raised through the Ice Bucket Challenge, where people dump a large bucket of cold water with ice on their head. The National Institute of Neurological Disorders and Stroke, NINDS, is one of the world's leading funders of research into amyotrophic lateral sclerosis, ALS. Its goals are to better understand the cellular mechanisms which lead to the development and subsequent progression of ALS, discover more about the genetics and risk factors associated with the disease, identify biomarkers, and to develop and improve treatments. Some of the current research programs for ALS include looking into what causes motor neuron cell death, the use of stem cells as possible treatments, comparing familial and sporadic ALS cases to identify genes involved in the development of the disease, discovering new biomarkers to improve the way the disease is diagnosed in patients, and they are also looking into what new treatments and therapies, including drugs, stem cell therapy, antibodies, and gene therapy.
Are you recording?
Someone that has a
My name is Connor, and today we're going to